So I'm James, Head of Patient Experience and Involvement from Kettering General Hospital, and this was meant to be a double act with a lady called Esther, who is the project lead for Young Health Watch. But unfortunately she is with Young Health Watch at Kettering General taking part in the place assessments today, so they couldn't make it. So on to our project, It's My Health Youth Voice. As much as I like to think that I'm a young person, I'm not anymore. And the way that we came up with this voice was Rock Band Name Generator. That was how we came up with the name for our submission, because we couldn't come up with something. So the young people suggested that. And these are the kind of suggestions and things that the young people we're working with come up with that we generally wouldn't think of. So this is where you can find us on Twitter for our organisations and both me and Esther. And this is just a quick video. Press enter.
Press the next arrow.
From Tansy, who's the chair of Young Health Watch, and it's with regards to our submission to PENA.
Hi, I'm the chair of Young Health Watch Northamptonshire. As a group, we are delighted to have our work shortlisted for the Patients Experience Network National Awards. Working with Kettering General Hospital is always fun, but more importantly, it's great to see the changes they've made based on what we have said.
And we have to use videos, and we have to engage with Young Health Watch in a different way because they are young people. And some of the things that we have at our organisation, like meetings, happen during the day when they can't make it. PENA happened during the day, so they couldn't attend, and that's why that video was submitted by Young Health Watch. So what is it? We had an enter and view style visit from Young Health Watch and a local learning disability group called Shooting Stars, who assessed our paediatric services. They looked at paediatric A&E, they looked at our paediatric outpatient department, and also our paediatric ward, Skylark. And they based their visit on 15 steps and those elements, but they looked at the ward in its entirety. They went through everything. And they had free roam, essentially. We let them wander. We made sure, obviously, there was no issues to start off with, so I ran ahead and made sure there was nothing that we need to keep them away from, to make sure they didn't get upset or see something that they wouldn't want to. And from there, they came up with an action plan. They told us, based on their visit and their engagement with staff, what they think we need to improve on. And there were about 8 recommendations. And they ranged from things like signage, decorating, and breastfeeding chairs, making them available, because it wasn't there. So we started the day in Skylark Ward, which is our paediatric inpatient ward, and they started at the doors and walked their way right the way through. Looked at the various different things that we offer, the facilities that are there. They spoke to patients, families, and gathered their feedback and what the recommendations were. From there we went down to paediatric A&E. They identified, actually, when you go from the triage desk, there's nothing to help direct the patient to paediatric A&E. It's down the corridor, take a left. And they've come up with recommendations about improved signage and also something simple like things on the floor, footsteps or fish for them to follow. They also recommended in our paediatric A&E that it was very bland. There wasn't really much going on in terms of engaging patients. It was quite bare walls. So they suggested a nautical theme, which we followed up on and redecorated. And we also used that signage issue, we used fish to tie in with that nautical theme. They also suggested in our A&E that we didn't really have anything to keep the children entertained. So we had so much going on our paediatric ward and outpatients with books and board games and things like that. We moved some of those things down to A&E and shared them to make sure that those patients sometimes just take their mind off what was going on. Now, with their recommendations, we pulled together an action plan. And one of the ways that we've recognised that we could have improved is actually involving them within that action plan, rather than saying, this is what we're going to do to respond and address your issues. We didn't have that conversation, discussion in terms of, actually, do you think this would meet those needs? And that's something that we are developing for our next review, because we're going to involve them moving forward. The final report itself was produced by Young Health Watch and Shooting Stars. They did it in their format, they did it how they wanted to do it, and then we checked it and made sure that it was factually accurate. Like I say, the action plan was implemented, and for us there's some learning in terms of making sure we involve Young Health Watch through that process. And then there was a formal report launch at Takeover Day. So for those of you that don't know, Takeover Day is a national day where children, young people are invited into organisations to participate in adult roles. And we used that as an opportunity to launch the formal report and participate in Takeover Day as well. And we asked Young Health Watch, actually, rather than doing a formal report, as we're used to in the NHS, it's usually papers to various committees, how should we demonstrate the impact they've had on that day? And they suggested that we'd capture it in a video, and I'd like to share that with you.
Kettering in general and look at all the other projects that the other staff want us to take part in. I think it's a really exciting opportunity and will definitely help us learn a lot.
It's quite tiring, so I feel quite ready to go to bed and not have to.
Waking up wasn't too bad for me really, and I felt quite like, I could see I was quite energetic in the morning, but as I was going on, I felt quite like switched on throughout the day. So towards the end of the day, like right now I do feel quite tired, to be honest. But it was still really exciting seeing all those things. Like honestly, I don't think I would have had the chance to do this anywhere else. So to get to do those different like biology lab and everything, all of that, was just really good experience, and I did enjoy it. It was great.
There was the clinical skills lab because I don't like the look of the canyon is, but I like how it's like done and everything.
So just a different way and working with young people in terms of how we demonstrate what we've done. So when we shared what happened with Takeover Day and the report launch, actually we just showed this video. We took it around the various committees, and it means more because you see the impact that it's had on the young people that have been involved and actually how meaningful it's been. So we started off by, this was in a bit of a funny order, but we started off by the launch of the report, which was to our nursing director, medical director, it was to our chief executive, to paediatricians, and they told them what they found about the services, how it was for them when they visited, and what their recommendations were and why. And from there they went to clinical skills lab. They learned about taking blood and then took that blood down to pathology and looked at what happens to blood when it goes through that system, then on to pharmacy. And we're having them back this year to attend Trust Board as part of that Takeover Challenge. This has led on to a number of different things in terms of other work that we've done with Young Health Watch and the youth volunteers, and this was led on to Christmas last year, where we visited over 100 patients. We worked with local schools and they produced Christmas cards which we delivered to those patients, and it just sparked conversation. We deliberately went to older adult wards, and it was the young people delivering those presents and those cards, and it really did spark some really nice conversation and engage those people. So future plans to continue to work together on the quality improvement for the patients at Kettering. Revisit 15 steps, but look at other areas, and you mentioned earlier about the transition. So we're going to look at radiology. We know that young people use radiology services. It's not necessarily just specific to paediatrics. Gynecology, so we'll have those patients that transition and start using those services, and our gastro ward. So we have a specific gastro ward where we know that younger adults attend. And they'll hopefully then be able to compare the paediatric services, which when you walk onto our Skylark ward is bright and colourful, and every side room has its own PlayStation, and they've got a breakout room, and they've got floor screens that you can stand on and interactive, where actually you don't have that in radiology, and you don't have that in our gastro ward. So how can we make those environments more suitable? And again, they'll be launching their report and producing the report themselves in the very same way. This has also led on to us now as an organisation. How do we work with youth volunteers ourselves rather than working with Young Health Watch and involve a wider audience? Because actually it's not something that we do. And that's a link that our volunteer services manager is working with Esther to try and develop that. That's it from me. Any questions at all?